Blood circulates inside the blood vessels, which form a closed transport system, cardiovascular system. As the heart beats, blood is propelled into large arteries, leaving the heart. The blood then moves into a smaller arteries and into the arterioles, which feed the capillary beds in the tissues. The capillary beds are drained by venules, which in turn empty into veins and finally empty into the great vein entering the heart. Arteries carry blood away from the heart, and veins return blood toward the heart. Capillaries are the smallest blood vessels, and the exchange between body cells and the blood only occurred through their walls. Microscopic anatomy of blood vessels. Tunics. The tunica intima lining the interior of the vessels is the thin layers of endothelium, which rests on a basement membrane. It has a sleek surface that decreases friction as blood flows through the vessel's lumen. The tunica media is a bulky middle coat, which is made up of smooth muscles and elastic fibers. Some larger arteries have elastic laminae, sheets of elastic tissues. The smooth muscles change the diameters of blood vessels. As the blood vessels constrict or dilated, the blood pressure increases or decreases. The tunica externa is the outermost tunic. It's composed of fibrous connective tissues. It functions to support and protect the vessels. The structural difference in arteries, veins, and capillaries. The walls of arteries are usually thicker than those of veins. The arterial tunic media is much heavier. Arteries must be able to expand as blood is forced into them and recoil passively after the blood flows off. Thus they need to be strong and elastic enough to take the constant changes in blood pressure. The blood pressure is always low in veins, thus they need thin walls. Because the blood pressure is too low and the blood returning to the heart flow against the gravity, veins are modified to have larger diameters and valves that prevent backflow of the blood. Skeletal muscle activity also enhances venous return. When we inhaled, the drop in pressure in thorax caused large veins near the heart to expand and fill. Because there is only one layer of cells in the capillary walls, exchanges between blood and tissues are easy. The tiny capillaries form intervening network called capillary beds. Microcirculation is the flow of blood from arterioles to venules. There are two types of capillaries: vascular shunt and the true capillaries. A vascular shunt directly connects the arterioles and venules. True capillaries are the actual exchange vessels. A capillary sphincter surrounds the root of each true capillaries and acts as a valve to regulate the blood flow into capillaries. When the capillary sphincters open or relax, the blood flows into true capillaries. Major arteries of systematic circulation. The aorta is the largest artery of the body. Different parts of the aorta are named for either their locations or their shape. Smaller arteries branch from different parts of aorta. Ascending aorta, aortic arch, thoracic aorta, and abdominal aorta. There is a picture on book page 379. Major veins of the systemic circulation. Veins converge into venae cavae, which enter the right atrium of the heart. Veins jump into different parts of the venae cavae, the superior vena cava and the inferior vena cava. There's a picture in the book page 381. Arterial support of the brain and the circle of Willis. The brain is supplied by two pair of arteries, the internal carotid arteries and the vertebral arteries. The internal carotid arteries run through the leg and enter the skull through the temporal bone. Inside the cranium, they divide into anterior and middle cerebral arteries supplying most of the cerebrum. Each vertebral arteries pass upward from the subclavian arteries at the base of the neck. Within the skull, they join to form single basilar artery, which serves the brainstem and cerebrum. At the base of the cerebrum, the basilar arteries divide to form posterior cerebral arteries, which supply the posterior part of the cerebrum. The anterior and posterior blood supplies of the brain are united by a small communicating arterial branches, resulting in a complete circle of connecting blood vessels called cerebral arterial circle or the circle of Willis. Fetal circulations. The exchanges take place in the placenta in fetal development. The umbilical cord contains 3 blood vessels, 1 large umbilical vein and 2 smaller umbilical arteries. The umbilical veins carry blood rich in nutrients and oxygen to the fetus, and the umbilical arteries carry blood rich in waste and carbon dioxide to the placenta. The blood bypasses the immature livers through the ductus venosus and enter the inferior vena cava. The blood bypasses the lung because they are non-functional. Some of the blood entering the right atrium is shunned directly to the left atrium through the foramen ovals. Blood that managed to enter the right ventricle is pumped out of the pulmonary trunk, where it meets a second shunt to the fetus, and the umbilical arteries carry blood rich in waste and carbon dioxide to the placenta. The blood bypasses the immature livers through the ductus venosus and enter the inferior vena cava. The blood bypasses the lung because they are non-functional. Some of the blood entering the right atrium is shunned directly to the left atrium through the foramen ovals. Blood that managed to enter the right ventricle is pumped out of the pulmonary trunk, where it meets a second shunt, the ductus arteriosus, a short vessel that connects the aorta and the pulmonary trunk. After birth, the foramen ovals closed. and the ductus arteriosus collapses and is converted to the fibrous ligamentum arteriosum. Hepatic portal circulations. The vein of the hepatic portal circulations join the digestive organs, spleens, and pancreas and deliver this blood to the liver through the hepatic portal vein. As blood flows through the liver, some of its nutrients are removed to be stored. The major vessels composing the hepatic portal circulations include the inferior and superior mesenteric veins, the splenic vein, and the left gastric vein. The inferior mesenteric vein, joining the terminal part of the large intestine, join into the splenic vein. The splenic vein joining the spleen, pancreas, and the left side of the stomach. The splenic vein and the superior mesenteric vein join to form the hepatic portal vein. The left gastric vein, joining the right side of the stomach, joined into the hepatic vein directly.